Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Mohan Bhargava will tell you how to do it.
Thank you, Professor Roberto Ferrari. And I agree totally with you that the step down on increased sodium intake should be done, because this causes a significant number of hypertension incidents globally as well as in Asia. Particularly, it is more so when we talk about India. The WHO recommendation as far as the salt intake is concerned, the recommendation is 5 grams per day, but average intake in Indian is roughly about 11 grams per day, which is quite high. And we know that increased salt intake would lead to increased incidence of hypertension, thereby resulting into various complications on follow-up. The salt intake, as we know, so what should we do as far as the restriction of salt is concerned in the intake? So, like when we talk about meals, in India we should restrict salt in rice, in the dough which we use for chapati, the roti or the puris. Besides this, we should restrict salt intake in salads, fruit cuts. Besides that, in curd, the cooked vegetables. The salt should also be restricted in cooking, and once we restrict salt, we can gradually reduce the salt intake to the least amount which is required for taste, thereby restricting salt in our daily meals. Besides that, the salted items should be avoided, which is mainly salt, salted butter, cheese, then salted namkeens we have as in India. Besides that, sauce, papad, achar and other preserved tin items. Once we restrict the salt intake, then a significant number of hypertension individuals will have a better control, and that would prevent lot of events during follow-up. The awareness in India is less, so a step down on high sodium intake is a very important and positive step, which should be, the message should be given to all individuals. And we we should know that this leads to hypertension, which is a silent killer, and thereby you can reduce the incidence of heart attacks, stroke, as well as the chronic kidney disease. As we know that chronic kidney disease is also once it occurs, it leads to significant mortality. Thank you.